Welcome to Mr. Chalk's Revision Tips. In this video, we will look at
contraception, hormonal contraception and non-hormonal contraception. So, birth control, also known as contraception or fertility control, is a method used to prevent a pregnancy. So, there are a few different types. We've got barrier contraceptives, which prevent the sperm from entering the woman's uterus. So, they're physically stopping the sperm and the egg from meeting. We have hormonal contraceptives, so something like the pill. They all contain a small amount of man-made estrogen and progesterone. So these hormones inhibit the woman's natural menstrual cycle, so eggs never develop and aren't released by the ovaries. So oral contraceptives. So human fertility is controlled by hormones, like we've previously seen. So fertility can be controlled by the use of these hormones in contraceptives. So the oral contraceptive, more commonly known as the pill, contains estrogen, progesterone. So these hormones inhibit the production of FSH, so therefore no eggs mature. There are a few risks and benefits. So oral contraceptives are more than 99% effective if taken correctly. However, there are possible side effects such as changes in weight, mood, blood pressure, etc. Modern pills don't contain as much estrogen as the original form of the pills, so there are far less side effects now than there were originally. Contraceptive injections, implants or skin patches contain slow release progesterone to inhibit the maturation of eggs, and that can be another way of taking these contraceptives rather than having to take a pill every day. So if we're explaining how the contraceptive pill works, the important things to talk about is that it inhibits FSH, so therefore there's no egg maturation. Give two advantages of it. So something like it's 99% effective, and it can go and help women who don't have regular periods, as it can make them more regular. If we're looking at disadvantages of birth control pills, you need to be talking about the fact that it's only 95% effective, not 100%. There can be side effects. You have to remember to take them every day, and it's not necessarily, or it isn't a protection against sexually transmitted diseases. So non-hormonal methods of contraception include things like physical barrier methods, so condoms, diaphragms, which prevent the sperm from reaching the egg. You've got intrauterine devices, such as the coil, so these can be implanted and stop the embryo from developing. Spermicide agents, so that kills sperm cells. Abstinence, of course, and there can be surgical methods of sterilisation, so therefore either a man or a woman becomes sterile and can no longer produce those sex cells. So there are a few risks and benefits. So condoms are quick and easy to use, but sometimes can tear or rip. Diaphragms need to be put in just before sex and left in for several hours afterwards. IUDs need to be fitted by a health professional. So an IUD can remain in position for up to 10 years. However, there is still a small risk of it causing an ectopic pregnancy. Spermicide agents can be added to other physical barriers such as condoms, but some people can have allergic reactions to these. And surgical methods can't be reversed, so once you make that decision, then you've got to kind of stick with it. So the table below shows some methods of contraception. So if we're looking at which method is the least effective, You can see there it would be the diaphragm. Which method will protect you against sexually transmitted diseases like HIV? It would be the condom, because that's a physical barrier. So if we see here, we've got a table comparing two different types of IUDs. It's important when you get a question that has a table that you spend some time looking at it. So another method of conception is called the intrauterine device. So evaluate the use of the plastic IUD as a contraceptive compared to the copper. So some of the key things that you would need to talk about. So the advantages of using the plastic IUD is it's effective for a longer period of time. It doesn't need to be replaced as often. Although the pain of periods are more severe, the pain with the copper IUD is likely to be worse. It can reduce bleeding during the period, and most of the possible side effects are serious or are not serious. So the feeling sick or acne or headaches. The disadvantages is that it needs to be implanted for a period of time before it's effective. It can make the pain of a period more severe. It can cause more side effects, and it can cause some more severe side effects such as cysts on the ovaries.
Thanks for watching.